In today's lesson, we will be discussing how to use data and the planning guide to implement prevention and SEL programming. At the end of this lesson, you will be able to collect and evaluate data relevant to prevention and social-emotional programming, and use that data and the planning guide to establish a program to meet the needs of your students. Social and emotional learning is the process of teaching children to understand and manage their emotions, foster hope through goal setting, learn empathy for others, positive relationship skills, and how to make good decisions. The Collaborative for Academic, Social, and Emotional Learning, CASEL, identifies 5 competencies of social-emotional learning. They include self-awareness, self-management, social awareness, relationship skills, and responsible decision-making. Teaching SEL programs in school has shown to improve long-term and lifelong outcomes for students. Prevention, or health promotion, is often used in schools to target specific outcomes. Programming efforts focus on reducing the risk of negative outcomes. Examples include healthy relationships, substance use, sexual health, and others. Programs and curricula may target specific outcomes, but research shows that the key principles are all the same. Prevention efforts are multi-level and should encompass more than just classroom instruction. We will be discussing best practice for effective implementation of SEL and prevention programming through the use of the social ecological model, the SEM model, and data-based decisions. Effective implementation takes planning. This is the model for effective prevention programming implementation. First, you should start by assessing the needs of your students. No one knows your students and their needs better than themselves. Next, you will take the data you collect to identify areas of concern. After that, the team will plan the prevention or SEL using the SEM model. Now it is time for implementation. Once the programming has been implemented, always go back and evaluate the effectiveness of the programming and if it was implemented with fidelity. And then you begin the process again. When looking to assess your students to identify areas of need, there are several methods that can be used. Included in this lesson are school climate surveys for both elementary and secondary students, as well as school staff. There are also free and low-cost student surveys and screeners that can be used to identify individual and group needs. Once you have administered the surveys, your team may want to conduct a focus group. Identify a few areas that you would like to understand in more detail. Then, lead a focus group of students. This will give further insight to areas of concern and give students a voice to explain their needs. Another good source of information is the Oklahoma Prevention Needs Assessment. Students across the state take the OPNA every couple of years, and this data is used to plan statewide prevention programming, as well as can be used by areas and schools. School climate surveys are a great way to measure the students' perceptions of the climate of the school, as well as identify areas of strength and concerns from the student's perspective. These surveys give students a voice and a safe place to express their feelings and needs because they are often anonymous, quick, and cover a variety of topics. School staff climate surveys are also a good source of information, as teachers and staff often have a unique perspective on school climate. The survey included in this lesson is intended for all school personnel. It can be turned into a Google form to quickly and easily collect the data. Included in this lesson are 2 school climate surveys designed by the OKTransform team. We have an elementary survey intended for students in grades 3 through 8. The secondary school climate survey was created in collaboration with Oklahoma youth and prevention experts. This survey includes school climate questions as well as relevant prevention topics. Additional resources in this lesson include introductory statements for each survey and opt-out forms for parents. These resources are intended to help with the administration of the school climate surveys. Another helpful tip is to use a Google form to administer the survey. This will help with quick and easy data collection and evaluation. Social emotional screeners are another great way to collect data for SEL and prevention programming. If you already have an SEL curriculum, check to see if a screening tool is included. This will help drive your programming to meet the needs of your specific population. If you are looking for a free or low-cost social emotional screening tool, you can look at the comprehensive integrated 3-tier model of prevention's website for a list of resources and screeners. 2 free screeners that may fit the needs of your students are the Student Risk Screening Scale and the Strengths and Difficulties Questionnaire. They can be found on this website as well. These tools can be used to identify needs of individual students if you are working within a multi-tiered system of supports for Tier 1 programming. Identifying priority areas for your student body will help guide your programming implementation by focusing on the areas of need. After assessing your students, you can identify areas of concern based on the results. It is likely that you will identify more than one priority health or social emotional behavior. Like in the fidelity and outcomes data lessons, you should identify the area of concern precisely. Here is an example of how one school used precision to identify the problem. 96 students, or 35% of the students in the school, stated they definitely or probably experienced feeling down, sadness, or hopelessness more days than not in the last 30 days. And students identified mental health as an area they would like to learn more about. This is why the school identified mental health as their first priority behavior. Identifying the priority behavior with precision can help when looking to evaluate the effectiveness of the program after implementation. Now we are going to discuss the best practice for program implementation. The SEM is a public health model that is used to elicit behavior change. From research, this model indicates that if a school focuses on at least 3 out of the 5 areas, you are more likely to see culture change. Preferably, we would like to see all of these areas as a priority. Planning a culture change, we cannot just focus on purchasing a curriculum. The program you purchased probably focuses on individual and relationship areas of this model. Individual is the knowledge and beliefs of the individuals in the system. Relationships focus on the modeling of behaviors and the relationships needed to create change. But we have to make sure we have a school-wide campaign that this topic is something that we take seriously in our school. And fostering community involvement through partnerships and including stakeholders and parents in the process expands the goals of the program. Finally, written policies that reflect the changes we are wanting to see will ensure sustainability of the prevention and SEL programs. In the programming guide provided in this training, it has been separated into 5 tasks. This will help your team develop an effective implementation plan for SEL and/or prevention programming. The first task is program curriculum and training. In this task, you will identify the curriculum and identify staff training needs. The second task is aligning with current practices. In this task, you will identify the current curriculums and practices that you are already using and align them with any new curriculum that you decide to add. Task 3 is the planning matrix. This is the section where you will align your implementation with the SEM model we just discussed. Task 4 is implementing a strategic plan, planning the schedule and the facilitation of the prevention programming. And Task 5 involves evaluation. This is where you identify ways to monitor fidelity and outcome data of the program. You can find a copy of the Prevention and SEL Programming Guide at the end of this lesson. As part of the Prevention and Social Emotional Learning Guide provided in this section, we have included a planning matrix with the 5 social ecological model levels, some examples of how to focus on these areas, and then a section for your team to include action steps to achieve implementation at each level. Examples of action steps for individual may be to first purchase and then teach the topic through an SEL or prevention curriculum. Action steps for school-wide may be to include concepts in expected behavior matrix, to put up signage around the building, and to continue discussing the topics outside of the curriculum lessons. Next, the planning guide will focus on the implementation of the social emotional learning or prevention curriculum. The guide walks the team through a strategic plan addressing these 3 areas. Who will implement the program? Sometimes it will be a teacher, school counselor, nurse, or through a community partnership. Next, focusing on which classroom or classrooms will receive the curriculum. Will it be grade level specific? Will it be taught during homeroom as an elective, during a class like health or social studies? This is where you will plan for the programming and when it will be explicitly taught and to whom. Finally, what is the programming schedule? What is the time frame for implementation? Will it be taught during a specific month or all year? Schedules will help with accountability and also sustainability of the programming. Finally, the very last step is we always want to make sure we are getting student and staff feedback. Programs often have pre- and post-tests included, but evaluation forms can also be used to collect data on the effectiveness of the program. This information will allow teams to make adjustments and make sure their program was implemented with fidelity and received the outcomes intended. As you begin planning your social emotional learning and prevention programs, remember to be intentional with your planning to ensure you are focusing on all 5 levels of the SEM, and always use data to drive your planning and programming. SEL and prevention programming is an important component of positive school climate and is a valuable Tier 1 practice. If you have any additional questions or need more information about programming, please contact Elizabeth Suddeth, MPH. She is the Executive Director of Prevention Services at the State Department of Education.